the issue around consent is really challenging. Now, for many people, they've been with their partner many years. And actually, even if someone is not verbal or has minimal sort of verbal abilities due to their disease, actually, often the partners can read and understand some of the signals in their normal behavior and be able to infer the sort of consent from that, the fact that they understand what is going to happen, the fact that they are able to sort of say, yes, I'm willing to sort of become sexually intimate with you. You know, it is a difficult area because, as you may be aware, obviously capacity is decision and time specific. So people with Parkinson's disease dementia, Lewy body dementia, Alzheimer's dementia, they may well fluctuate. So it's about not making a blanket decision to say yes or no, they have capacity or not. It's got to be taken in that point in time. Obviously, this is a hugely complicated area because, you know, it's a very personal thing. And I think people become very upset when there is almost overreach into someone's personal life and their home life. Obviously, if you've been married to someone for 60 years, 40 years, however long, you will feel much more understanding towards a person than a healthcare professionals that met them once. But I think it's about giving that message to say it's really important that the person understands and wishes to you know, become sexually intimate with you, and the fact that they need to be conscious that their partner needs to be very clear that they want to be sexually intimate. And it is not it's not just, oh, they're physically aroused, this is fine. Actually need to be satisfied that this is them either saying yes, they are happy, or showing signs that they are following what will be their normal pattern over the past 20, 30, 40 years when initiating sexual intimacy. It's very difficult because obviously Alzheimer's, Parkinson's can affect younger people as well. So when you are, you know, with someone who is perhaps in their 40s or 50s and they've developed more advanced disease, yet their partner is young and you know, ordinarily would remain sexually active, and, you know, and a younger person, say for example with Alzheimer's, might not have any other physical issues. What do we do there? It's really challenging. So it's so important to talk about it because, as I said before, we need to make it uncomfortable. We need to make sure that our patients' rights are being respected. You know, think of them as if it's a woman, it's a drunk woman and she's incapacitated, and, you know, a man slept with her, that would be rape, wouldn't it? So if someone is incapacitated because they have dementia and they're just lying there, it's rape as well, you know, and it's really difficult. We need to make sure we're protecting our patients without overreach as well. Consent is decision specific. So, for example, someone might, if we think about an MMSE, for example, someone might have an MMSE score of 8, so a really bad score, and you'd say it's quite severe end of the spectrum. So absolutely, they couldn't consent for a heart transplant because they wouldn't be able to understand the complexity of the decision they were being asked to make. However, they might consent to being washed by a carer in the morning. Do you see what I mean? Because the decision is different. So it's got to be taken on a decision by decision basis. We can't have a blanket, say this person lacks capacity. This comes up time and time again. They lack capacity for that decision in that particular point in time. So we can't equate it to a cognitive score that's either done as clinical practice or in a trial. It has to be done at that time. And we have to look, do they display those 4 factors that I talked about? Can they understand, retain, weigh up, and communicate that decision?